Residents were on edge and many were growing desperate for relief. As temperatures climbed, it became evident that the health impacts of the heat wave were becoming more severe. Hospitals across the affected areas were overwhelmed with cases of heat stroke, dehydration, and other heat-related illnesses. The elderly and young children were especially vulnerable, and many of them succumbed to the heat. Hospitals were flooded with patients, and it quickly became difficult for medical staff to keep up with the growing number of cases. In some areas, families were forced to deal with the aftermath of losing loved ones who had fallen victim to the heat. These deaths, though tragic, were not the end of the crisis. The heat continued to take its toll in other ways, disrupting daily life in ways that people were only beginning to understand. In rural areas, where agricultural workers and farmers relied on their crops for survival, the heat wave was devastating. The drought that had been creeping across the Midwest and Ohio Valley continued to worsen, and crops were drying up faster than they could be harvested.